Okay, questions and discussion. Let's go ahead and let's see what kinds of questions we have in the chat, what we've been getting.
Thank you, Barbara. Thank you, Sheila, for great presentation. Hi, I'm Shantala Ahania. I'm one of the HAI IP working with Sheila and Barbara. So I think I'm going to start with the first question to Sheila. Sheila, if we can go over the difference between the standard precaution and enhanced barrier precaution. There was a question regarding why we have included EVS staff need to use PPE.
Okay, so as you know, when it kind of glitched, so I missed half of the first part of the question, but the EVS staff require PPE when we use ESP because each bed space is unique. So we treat it like a separate room. And when you're working with a resident that's high risk and it has those risk factors, their environment is contaminated. So they're coming into close contact with the resident or the environment. And we don't want them moving it from one resident to the other. So that is why we do ask for the use of PPE, gowns and gloves, and for that to be changed when you're going to move to the next resident.
Thank you, Sheila. Next question for you, Barbara, is if there was a question regarding, I think we had a similar question from last two sessions, is how it's going to impact the resident mental health and PPE fatigue. Do you want to take that?
Sure. I mean, that's obviously a concern as we're just coming out of the pandemic. I certainly understand those factors. Actually, we feel like this is going to help reduce PPE fatigue because you're going to be using PPE in a more strategic approach. So hopefully this will help your staff with less PPE fatigue because they're only using it in the 6 moments.
So do you want to go over how it helps the resident to be, it's not restricting the resident with any of
Yeah, so unlike if the resident is on transmission-based precautions, they are not able to leave their room, where ESP allows them to leave their room. And I feel like in messaging, when we message that it really does help the resident have a better quality of life and more socialization, then staff and visitors and the residents themselves are more accepting of the times that we do have to wear the gown and gloves.
Thank you so much. The next, I think there is again, a lot of people are having the same issues, that the staff are still not able to comprehend going back to using the gowns. They're all used to using the gloves, but gown is in addition to this for high risk activity. But one thing the staff, there was a question, Barbara, that Amelia mentioned, so it doesn't help at all. Even after explaining to patients, families, and staff, they're still tired of seeing the PPE. How we are messaging is there any other examples you want to give for the audience, for the attendees to improve compliance?
Yeah, there's a few different approaches we can take here. One is that we have had an increase in MDRO prevalence over the last few years of the pandemic. The pandemic has led to an increase of multi-drug resistant organisms, which is why we really need to take this approach to keep everybody in the facility safe. So it's a patient safety initiative. And I feel like when we explain that, that there's been a change in the microbiome, if you will, of what's out there in healthcare facilities as a result of the pandemic, And this is a patient safety initiative so that we don't have MDRO spread in our facility. I would suggest using that as a possible way to engage staff and residents, because those are very true and real factors that we're dealing with and we see on a regular basis. And a skilled nursing facility that has had a Canada RS or CRO, Indian crab or something in their facility can tell you then how much more you do have to do in terms of contact isolation for a number of residents. And it definitely has a impact on the facility. So trying to keep spread out is something that we are striving for with ESP.
Thank you so much. Go ahead.
Sorry, can I just add a little bit, something else to maybe share with that question about they still don't see how it's any different, with the ESP and PPE usage. You can remind them or share with the visitors that they are now able to visit their loved ones without PPE unless they're engaging in those high contact activities. That's one of the differences. And anyone on ESP can also go into the common areas without wearing PPE because we get them ready for that, assisting with hand hygiene, putting clean clothes on, and then they can go without wearing PPE. And additionally, for the staff, if they bundle their activities of when they're going to do those high contact activities and do it all at once, that would also reduce the PPE usage and having to change if you're going in and out to do bundles at separate occasions. And then there are a few things that if you're not going to touch the environment, that you wouldn't have to wear the gown on, such as turning off an alarm, taking in a tray, a food tray. And so those are the things that maybe you can discuss and share, and those would be the differences versus having somebody in complete isolation.
Thank you, Sheila. Barbara, this question to you again, it's for how do we know when to utilize transmission-based precaution or enhanced standard precaution?
So let me just repeat the question. So how do we know when to use transmission-based precautions or ESP? Was that the question? Okay.
Yes.
So you're going to use the transmission-based precautions as you always have, as outlined in your policy, and by referencing the documents on when to use transmission-based precautions. And then in our toolkit that we've talked about on that enhanced standard precautions for skilled nursing facilities guide on page 5, it talks a lot about the transitioning from transmission-based precautions to ESP. So reference page 5 of that document, but in general, it just talks about like for MDRO colonization, you may not need to use any type of isolation. You should look at and see if the MDRO is one that you are very familiar with and have a high prevalence in your county, like MRC, B or E, ESBL. Then you may not need to have anything more than standard precautions for that patient. However, based on the community prevalence for a more novel pathogen, then it may be appropriate in consultation with your local public health department to keep that patient on contact precautions or allow that patient, if they're colonized, to be on ESP. So work with your local public health about the pathogen you're talking about, and then determine whether or not ESP is appropriate.
Thank you, Barbara. Similar to the same line, Sheila, if we have a resident who has colonized MDRO and we practice ESP, family and resident question, why do we still need to wear gown when they're already colonized or asymptomatic from MDRO or they have completed their antibiotics. I will start with that and then I will pass it on to you. When you have it all, as Barbara previously mentioned, it all depends upon the pathogens, the germs, the organisms. However, you want to talk to your staff and your resident and the family members. So use the language, very simplified language when you're talking to the staff, talking to the family and the visitors, because these germs can stay in the environment, resident environment, more than, depending upon the type of germs. So it can stay up to a day to a week to a month to few months. For example, what Barbara mentioned, carbapenemase resistant Acinetobacter baumannii, it's a long term for a crab, can stay up to 6 months in the environment. So I may have that colonized. I may be colonized with that MDRO, but if the staff is not practicing good hand hygiene and a good PPE practice, so then you're taking that. So your staff are contaminated with their hand and their clothing. Now, as Sheila mentioned in the beginning of the presentation, now we are taking that to other residents, so who may be more vulnerable to acquire that germs or acquire that MDRO, and now you're silently spreading the germs in your building. So when you're not really practicing your good standard precautions, since we have observed many of them are not practicing standard precaution, this enhanced standard precaution is telling you these are the high-risk patient resident population, and you really need to use your gowns and gloves when you're doing high contact activity. With that, I will pass it on to Sheila to add additional information. Thank you, Sheila.
Okay. Thank you. Yeah, I just wanted to add that when a resident is colonized with an MDRO, it's still transmissible. We can still spread it, although it's not as easily spread. Sometimes we can say versus somebody that's infected, colonizations can still be spread. So that is why ESP is designed for patients that we may not even know their MDRO status. We may not even be aware that they may have it. And so that is why instead of focusing on, do they have it, do they not, are they colonized, we focus on, is this resident, does this resident have the risk factors that we mentioned, which are a device, an indwelling device, or a draining wound? If the answer is yes, then we proceed to what type of activities will I be doing with that resident when I go into the room? And all those mentioned in the 6 moments would require the use of PPE for the protection of not only colonized patients, residents, but also those that we may not, their MDRO status is unknown.
Thank you, Sheila. Thank you. Many of these questions will be answered in our FAQs. So it's almost ready to be posted. So it'll be available along with all the questions were asked during these sessions. Will be posted it will be available for all the attendees, as well as anybody else who wants to go back and review. Next question for you, Barbara, is you covered it in last 2 sessions regarding the PPE placement and storage. If you want to explain or give some the options where they can store the PPE. Thank you.
Yeah, so CDPH is not prescriptive on where to store the PPE. We are saying that it needs to be available and handy, if you will, towards the point of use. However, we recognize that every facility has a different layout. And so I really would encourage you to look at your facility layout to see what makes most sense for your facility. again, just making sure that it is close to the point of use is the recommendation. Where exactly it is, because everybody's built just so differently, we leave that up to your leadership. Just making sure that in training, you've identified a place that the multidisciplinary team agrees is best for your facility, and that you've identified who's going to keep it stocked and who's going to make sure that everybody that's all new staff are going to be educated on where to find the PPE.
Thank you, Barbara. Sheila, this question was, a couple of questions were asked related to dietary staff, PPE for dietary staff, or if they're passing the just the oral medication, do they need to use gown? If you want to cover that, that'll be great. Thank you.
Yes. So good question. Those are one of those specific activities that we can feel comfortable saying that gowns are not required. As long as you are not bundling your activity and going in to do more than delivering the food tray, that would be okay not to wear that PPE, the gown, because the intent is not to be interactive with the environment or the patient. So that would be fine for you not to have to wear that.
To the same line, Sheila, can you cover for any special handling for linen, trash, and do they need disposable utensils? So any.
Okay, yeah, thank you, Chantala. No, so for ESP, there is no special handling of trash, of linens, or utensils. It's treated the same as any other trash, linen, or your utensils. The process to disinfect them when they're cleaned is perfectly acceptable. So there's nothing different you need to do for patients on ESP when it comes to those items.
Thank you, Sheila. There was a question, yes, on last two sessions was related, do they need to have a separate trash and separate linen for in the room if the resident is on ESP? No, it is not required, as Sheila mentioned. Just to remind everybody, it is no special other precautions. Barbara, this question for you. For the therapy staff, therapists, can they use gloves in the hallway?
Yeah, so this has been an ongoing question for many years. The first thing to do is to identify why we would need to use gloves, and really trying to understand the concerns of your therapy staff. Reminding like the therapy staff that a resident on ESP has had a clean gown put on, so they would be interacting with somebody that is already wearing a clean gown. I would really just encourage more of a conversation about this. In general, they can wear gloves in the hallway if they are participating in direct patient care. They can also have a pair of gloves in their pocket if they aren't planning on having very close contact, and then something changes in the patient's condition as they're ambulating them, perhaps, where they can put the gloves on quickly to provide care. So I would encourage everybody to start thinking more, what is the general principle, and then how do we roll that out in our care environment.
Thank you, Barbara. Barbara, do you want to cover a little more about the PPE supplies, or in the therapy room, if they're taking any ESP, any resident goes to the therapy room for, and what's the requirement for the therapy staff inside the therapy room?
Right. So a therapy room, again, it can be different depending on what's going on and what kind of therapy we're offering. So if the therapy staff is just, having somebody that's already able to ambulate sit on an exercise bike, then they wouldn't need to, they're not having direct patient contact with that resident, then we wouldn't need for the therapy staff to change into gown and gloves. However, if the therapy staff is helping the patient move up and down and having very close physical contact, then they would need to have the available resources in the therapy room, as well as be educated and trained on donning and doffing PPE due to the closeness of the activity. So in general, we need to look at the 6 moments and review those 6 moments with your therapy staff. This is why we always have to do things in a multidisciplinary approach, really, in infection prevention, and go over those moments with your therapy staff so that everybody understands when it's appropriate, when it's not, and have the supplies available to do it.
Thank you, Barbara. Barbara, I think it's the question, what we talked about, keeping a pair of gloves in a pocket. I think there was a couple of them have got surprise question. I think they're a surprise. So can you go a little more about it's okay for them, why it is okay for them to keep a pair of gloves, not only a pair of gloves in their pocket?
So we're talking about, I am just about ready to ambulate a patient, and I'm going to put 1 pair of gloves in my pocket. I'm not going to put a whole box of gloves in my pocket. And then whether or not that is used, I would discard those gloves and not, use it from patient to patient and not keep accessing my pocket. It's a strategy in case that there's a change in the patient condition that requires my immediate attention. It's not something you would do on a regular basis. It is just a strategy for certain residents.
Thank you, Barbara. I think there's a lot of questions on the keeping the gloves in the pocket. In general, infection control practices, we do not recommend that you had to, but for the therapy staff, it's only for the therapy staff because they're holding, sometimes, as Barbara said, they're walking them in the hallway all of a sudden, so then they may slip, or they may have to hold them in and they come in close contact with them. So, or some situation, they may have a Foley bag, so then they may have to touch that. So we are looking at from the employee perspective for their safety. So that's the only reason. So you don't want to touch a Foley bag with your bare hands. So looking at the situation, you had to, as Barbara mentioned, do your risk assessment, and then you had to make sure your staff understand when they can use the gloves in the hallway. For example, if you have your CNA are picking up dirty linen, so if you're asking them to carry it with in that situation where, yes, they have handled the dirty linen before they come out of the room, they remove the dirty gloves, do hand hygiene, put a clean pair of gloves, and if they're taking that to the dirty linen area, it's okay. You always have to do your risk assessment and train your staff when they're able to use gloves. It's not so, as Barbara said, do your risk assessment. I think there are several questions regarding the when they're giving IV infusion or injections, do they need gloves and gown? Sheila, do you want to take that?
Yes. So we are still talking about in their room, a patient with ESP in their room. Is that correct?
Yes.
So yes. If you are going to be manipulating depending on where the infusion is, that's usually recommended to wear your PPE for those patients. If you're just coming with PO meds, I'm going to hand it to them. You're okay without having to use your PPE, again, also with the G-tube, depending on the potential for splash, that would still be an opportunity to wear your gown. So a quick handing of medication, it would be okay not to. Again, we want everybody to kind of assess the activity that will be being performed and how much you'll be in contact with the environment or the resident themselves.
Thank you, Sheila. Barbara, back to you regarding, there are a few questions regarding the MDRO, especially the CRS patient CRS situation. If a resident has been on a transmission-based precaution for CRS for a year already, are we able to retest again? And if results come back not detected, are we able to just use ESP?
So a few comments on that. Number one is to coordinate with your local public health department. So that's just the beginning of the conversation. You have to coordinate with your local public health department because we have over 60 counties in California. Each one has a different prevalence and history with CRS and the other MDROs as well. So beginning with public health, and then if public health, so if it's naive to your facility or naive to your county, then they may have a different standard for moving the patient, transitioning the patient to ESP. So it's very county specific, to be honest, in when you can transition and when not, but it always begins with a conversation with your local public health department and looking at the resident's status.
Thank you, Barbara. And there was a second full question. Can they retest again?
No, retesting is not recommended as a way to eliminate transmission or ESP or transmission-based precautions.
Thank you, Barbara. I think there was a question regarding for MDRO database or in cohorting the MDRO residents. So yes, we do have in our FAQ, and I think we are also share, there is a cohorting chart which is available. Sorry, I don't have it handy right now, but we'll make sure that information will be provided for all the attendees on cohorting MDRO residents. And the next, I think there's Sheila, there is another question related to physician order. Do they need a physician order to place the resident on ESP?
So I think that's something that you need to discuss with your medical staff regarding what your policy is going to require. So we don't have that specified in our guidance. That's just something that you would determine. ESP is just an enhanced, standard precaution, and normally some facilities decide not to, and they put that sort of in a standing order or in their program, but others approach it differently. So I think that would be best to bring to your physician leadership and discuss how your facility will be handling those patients. Residents, what we do want to make sure though is that you do document why you'll be, after you do your risk assessment, why your patient or resident will be placed in ESP, but in regards to the order, that's facility specific.
Thank you, Sheila. There was several questions related to the draining wounds, and if the draining wound, if they have a wound vac, can they be placed in ESP? So it's we will be answering those questions more clearly on our FAQ and during our office hours with more discussion. I think there is something I wanted to bring it up for the audience, for all the attendees. When Barbara, Sheila, and myself, when we're talking about use of gloves in the hallway, again, I see a lot of interaction. Please do a risk assessment for your facility and the staff and who can use it. And if your facility doesn't think it's not recommended, So you follow your facility policy. I think there is one more question I had regarding. I think we covered almost everything. Okay. What about EMTs and gloves in a hallway? Okay, I think we are going to take a lot more time on this use of gloves in the hallway. Maybe we will respond to that in our FAQ. We'll make sure that it will be, because we don't want to take too much time. And if again, as I said, we will be sending out many of these questions in our FAQ session. So please bear with us. And with that, I will pass it on to our partners, Lindsay Holland. She's our HSAG partner. Lindsay, take it away to go over the next steps.
All right, great. Thank you so much, Shantala. And thank you, everyone. And thank you to the CDPH team for the wonderful information that you presented today. We are so thrilled with the turnout from all of our long-term care partners who have joined us to really master the ins and outs about enhanced standard precautions. So just a few things that I wanted to know. So as we end our training session today, there is one more session that we are offering this week on enhanced standard precautions tomorrow. We're going to be repeating the same content, but if you want to listen again, you're more than welcome to. Also, please feel free to forward this and the future training opportunities to your other colleagues as well. And as additional support, we are hosting office hours on this topic next Friday, May 26th from 11 a.m. to 12 p.m. And on our Train the Trainer workshop website, if you scroll to the bottom, you'll find where that registration link is so you can register. And I'm going to put that registration link in the chat box right now so you can access that. All right, so there is the link. So you can access that and go to the office, register for the office hours. I also wanted to mention that there are 3 additional training workshops that we're going to be offering in June, July, and August. So June is going to be focused on UTI prevention. July is focused on infection prevention and control for CNAs. And August is focused on infection prevention and control for environmental services. And the last thing that I wanted to mention on this slide, you can also see that the website for these trainings, and that's what I put into chat, has everything you really need to move forward. It has registration links, links to the curriculums and the toolkits that we're presenting, office hours, and we'll also have the recordings of these sessions posted in case you want to go back and listen to it again. So if you go to the next slide, we would love to get your feedback. So if you can, please take a moment to let us know your thoughts about today's training. So in the chat box, I'm going to enter it now. This is going to be a link to SurveyMonkey. There's only 4 questions. So if you can, we'd love to get your feedback. Click on the questions and let us know how we did. Next slide. So here is the information that you need to know about obtaining your CEUs. So HSAG is the CE provider for this event, and we are approved to offer you 1.5 contact hours of CE credit by the California Board of Registered Nursing and the California Nursing Home Administrator Program, or NHAP. So to receive your CE certificate, you will need to access HSAG's Learning Management Center by clicking on one of the 2 links that I'm going to add to the chat box. So if you are new to the system, then you will click on the new user registration link. And if you have received CEUs from HSAG before, then you will want to click on the existing user link. So if you're new, what you need to do, it's pretty easy. You just need to set up an account. And once you have access, you just need to input your name and license number, answer 1 question, and then you'll immediately be able to download your certificate. And just wanted to let everyone know that the instructions for how to obtain your CEUs will be mailed out to all of you next week, so you'll have the information. And then one other thing that I'll mention is you can always, after you get your certificate, that will make you an existing user. You can always go back in the portal to access your CE certificate at HSAG's Learning Management Center. And I'll put that link into chat right now. And then the last thing that I wanted to mention, if you have any questions or you need any assistance, you can always reach out to Deborah Price, and I'll put her email address in the chat box right now.
I do have
If
a
you go-
quick question in regards to this use. If you participate in, say, this meeting and the next hosted meeting, you gain more CD credit, or is it just a one-time?
I believe it would just be the one time because it's the same content. So it's not new content or new material. So if you did 2 hours or the 1.5, it would just be the 1.5 hours. And then the last thing that I'll mention is just to make sure that you redeem your certificate by September 30th of 2023. So that gives you just about 4 months to get it. So that's all that I have. Going back to the CDPH team, anything that you would like to add to wrap up today?
Sophie, want to take it over?
Sure. Well, I think that pretty much does it for us today. The CEU link is being asked for in the chat. And as a reminder, we're going to send all that information out to you so that you'll have it, yes, in your email, and you can follow that little trail and there'll be instructions and stuff. So that should help you guys out. And then with that, thank you guys for coming today, and we really appreciate it. Take care.
Thank you.